Revolution, the inner the time. Paradise is the inner the time. Everybody me say watching the time.
What a world, what a place to be. So many people in misery. So much pain, so much poverty. We all should be free.
This is a boss.
See the beauty is everywhere. On the earth we must take the care. We live in a paradise. We must treat her right.
Here we go.
Love is the answer.
Hear me say,
Paradise. Revolution.
it's revolution in paradise. Here we go. Hear me say.
Okay, let's jump right in. Today we're looking at something highly specific, but absolutely vital if you're anywhere near an operating theater. Polyvinyl alcohol, or PVA, nasal packing. If you follow maxillofacial or ENT procedures, you know exactly how disruptive unexpected nasal bleeding can be. Well, the PVA nasal pack is a remarkably effective tool for stopping that bleeding right in its tracks. We're going to break down exactly why it works so well. Here's our clinical overview for today. We've got 3 main sections. Section 1 covers the efficacy of PVA packing. Section 2 looks at intubation-induced epistaxis. And finally, Section 3 details hemorrhage control and medication.
All right, Section 1, Efficacy of PVA Packing, focusing on material mechanics and fluid absorption. Let's get into it.
You know, to really grasp how this works, we need to zoom in on the microstructure. A PVA sponge isn't just your standard absorbent pad. It's a highly engineered, sterile, and biocompatible material made up of 3-dimensional, interconnected, open cells. Because of this specific cellular structure, the second it touches moisture, it provides incredibly rapid wicking properties, and it's totally lint and fiber-free. Plus, it's designed to be super soft and pliable, which is a must-have when you're dealing with delicate nasal mucosa.
Just look at this dramatic visual contrast. On the left is the compressed state, and on the right, the hydrated state. When it's dry, it is incredibly low profile, so insertion is super smooth. But the instant this open cell foam hits blood or other body fluids, it starts absorbing immediately. In fact, it swells up to a massive 6 times its compressed diameter. That is a huge volume expansion, and it happens incredibly fast.
So what does this rapid expansion actually achieve mechanically? Well, as it swells up to 6 times its size, it expands evenly. This gives you a very gentle, equal, but firmly locked-in mucosal compression. That perfectly distributed pressure is exactly what you need for the tamponade of anterior or middle segment epistaxis. And structurally, it's a double win. This firm expansion actively prevents the lateralization of the turbinate after things like septal surgery. It stabilizes everything while simultaneously stopping the bleed.
Moving right along to Section 2, Intubation-induced epistaxis, where we'll look at complications in nasotracheal procedures.
Now, let's talk about the real-world clinical environment. In maxillofacial surgery, the typical go-to method for intubation is nasotracheal. It's standard practice, right? But we all know it carries a very recognized risk. Guiding a tube through the nasal passage can frequently cause significant mucosal damage, erosions, and dissections. As a direct result, moderate to severe nasal bleeding, or epistaxis, often appears during that intubation process.
And we have the clinical study documentation right here that really drives home the reality of these iatrogenic complications. It's one thing to say, hey, bleeding is a risk, but it's another to actually see the hard data on how frequently that nasal passage gets compromised when a surgical team inserts the tube.
Just look at this number, 72. To put that into perspective, the clinical data recorded 72 distinct complications. We're talking significant bleeding, mucosal erosions, the works, across a sample size of just 44 conventional nasotracheal intubations. Actually, let's do the math on that. That averages out to 1.64 complications per procedure. That probability of bleeding is incredibly high, which is exactly why having a fast-acting hemostatic intervention on hand isn't just nice to have, it is an absolute necessity.
Which brings us to Section 3, Hemorrhage Control and Medication. Let's explore direct application to the operative site. So, how do we fix this? Well, the intervention isn't just some generic one-size-fits-all block of foam. You can precisely tailor it to the patient's anatomy. We've got standard PVA packs, and then we have packs with integrated platinum cure silicone airway tubes built right in. There are even slim pack variants made specifically to be used alongside nasal splints. Basically, surgical teams have the exact tool they need for whatever specific geometry they are looking at in the nasal cavity. Let's quickly compare the 2 main configurations. The standard one gives you maximum absorption volume, which is crucial for swiftly controlling heavy bleeding. But the airway tube configuration, that is a real game changer for recovery. Having that internal silicone tube significantly improves venting, heavily reduces the risk of airway obstruction, and just vastly enhances the patient's postoperative comfort, all while the foam around it maintains that perfect, equal tamponade pressure.
Now, let's talk about the actual sequence, because this epistaxis can be easily stopped by the PVA nasal stick. First, you identify the bleed right after intubation. Second, and this is a really vital technique, the pack is infiltrated with a hemistatic agent, like Exile, before it even goes in. Third, you insert the compressed stick into the operative area. And finally, as it hydrates from the bleeding and the Exile, it rapidly expands to achieve that gentle, perfect mucosal compression. Boom, the bleeding stops.
And this brings us to one of the most clever advantages of this material. This biocompatible PVA matrix doesn't just absorb fluids, it actually acts as a targeted delivery vehicle. Because the sponge conforms so perfectly to the nasal cavity as it expands, it takes whatever medication it was infiltrated with, like the X-acylate we just mentioned, and delivers it directly to the exact site of the bleed. It essentially holds the hemostatic agent firmly against the damaged tissue. To make sure this delivery is perfectly localized, surgeons have a whole menu of dimensions to choose from. Check out how thin these are when compressed. Some are literally 0.07 centimeters before they expand. Whether you need a small 4.5 centimeter pack or an extra large 10 centimeter one, having these precise options guarantees an optimal anatomical fit. It staunches blood loss across totally different patient profiles without causing any additional trauma.
To summarize the core utility of this tool, let's look at this defining statement from the clinical specs. PVA sponge ENT products are designed to staunch blood loss. PVA is biocompatible and in some instances can be used for postoperative tissue support and to carry medication to the operative site. I think that perfectly sums up the whole shebang. It's an aggressive, immediate intervention against bleeding on one hand and a gentle, biocompatible support system for delicate, recovering tissue on the other.
Which leaves us with a pretty compelling final thought. Given the hard data we've seen on the high frequency of mucosal damage during nasotracheal intubations, and knowing just how easily a PVA stick infiltrated with a hemostatic agent can arrest that bleeding, we have to ask, should this infiltrated PVA packing shift from being just a reactive measure to becoming a universal prophylactic standard in all maxillofacial protocols? It's definitely a question of optimizing patient outcomes that the surgical community is going to keep exploring. Thanks so much for joining me for this explainer, and I hope it gave you a really clear, engaging look at this vital clinical tool.
Here we go. Hear me say, it's revolution in paradise. Here we go. Hear me say, it's revolution in paradise.
Revolution, the inna the time. Paradise, the inna the time. Everybody, me say, watching the time.
What a world, what a place to be. So many people in misery. So much pain, so much poverty. We all should be free.
This is a box.
See the beauty is everywhere. On the earth we must take the care. We live in a paradise. We must treat her right.
Here we go.
Love is the answer.
Hear me say,
Paradise, revolution.
it's revolution in paradise. Here we go. Hear me say, it's revolution in paradise. Here we go. Hear me say,
Revolution.
it's revolution in paradise. Here we go. Hear me say, it's revolution in paradise.
You love the one another and love your brother. You love the one another and love your sister. You love the one another and love your mother. You love the one another and love your father.
Here we go. Hear me say, it's revolution in paradise. Here we go.
Love is the
Hear me
answer.
say, it's revolution
answer. Revolution, the inna the time. Paradise, the inna the time. Everybody, me say, watching the time.